Every family in this country has faced this moment. You're at the pharmacy. The pharmacist says, "Do you want the branded one or the generic? It's much cheaper." And suddenly you freeze. Cheaper? For your blood pressure? For your heart? For your child's infection? Why is it cheaper? Is it safe? It's someone cutting corners. No one really explains it. So today, I will. I'm Dr. Uttam Shiralkar. I've worked as a surgeon in India, the UK, and the USA. And I'm going to tell you exactly how surgeons think about generic medicines. Not emotionally, not politically, just practically. And by the end of this video, you won't feel confused at the pharmacy counter again. Let's keep this very simple. When a company invents a new medicine, it spends years testing it. That costs a lot of money. So the company gets a patent, which means only they can sell it for some time. After that time ends, other companies can make the same medicine. Same main ingredients, same strength, same purpose. That is generic medicine. It is cheaper because the new company did not spend much money to make a research for that medicine. That's it. Not magic, not mystery. Now, the big question, does it work the same? From a surgeon's point of view in surgery, I cannot take risks. If I give an antibiotic and it doesn't work, the patient can get an infection. If I give a blood thinner and it acts strangely, the patient can bleed. So, I only use medicine that are proven to work. For a generic medicine to be approved, it must show that it works in the body in almost the same way as the branded one. If it doesn't match closely, it does not get approved. So in most cases, yes, generics work the same. Then why are the people still worried? Because cheaper usually means lower quality in everyday life. But medicine doesn't work like clothes or electronics. The important part of the tablet, the active ingredient, is the same. What can be different? The color, the shape, the packaging, sometimes the inactive fillers. But the main working part is the same. Let me tell you what I see in real life. Most patients who take approved generic medicines do perfectly fine. Blood pressure stays controlled, sugar level stays stable, infections clear. But here is one important thing. Try not to keep changing between different companies again and again. If you are doing well on one version, stick to it. Consistency is important. There are a few special cases. Some medicines need very exact level in the body. For example, thyroid medication, some epilepsy medication, certain heart rhythm drugs. With these, even small changes can matter. So in these cases, I prefer that patients stay with one trusted manufacturer and check levels regularly. Not because generics are bad, but because precision matters more here. Now, let's talk about something interesting, something patients tell me. They say, "Doctor, this new tablet doesn't feel as strong." We check it. It's the same medication. So, what changed? Their confidence. Our minds are powerful. If we believe something is weaker, we may feel it is weaker. That doesn't mean people imagine symptoms, but belief can influence how we experience medication. Now, let's talk about money. This is very important. Many patients stop taking medicines because they are too expensive. They skip doses, they cut tablets in half, they delay refills. That is dangerous. Taking a reliable generic every day is much safer than skipping an expensive branded medication. Regular treatment saves life. Stopping treatment causes complications. As a surgeon, I worry much more about patients not taking medicines at all than about them taking approved generics. So, what would I do for my own family? If my family member needed antibiotics, painkillers, or blood pressure medication, I would be comfortable using good quality generic. If they needed thyroid or certain sensitive medicines, I would make sure they stay consistent and get regular checkups. That's the balanced view. Here is the truth. Generic medicines are not cheap substitutes. They are regulated medicines that become affordable after the patent ends. They are not perfect. No medicine is. But in most situations, they are safe, effective, and reliable. The real danger is confusion. The real danger is fear. So, next time you are at the pharmacy and someone asks, branded or generic, you can think calmly. Is it approved? Is it from a reliable source? Am I taking it regularly? If yes, you can take it with confidence. I am Dr. Uttam Shiralkar, and if this helped clear your doubts, stay with me because next time we are going to talk about something even more personal, what it feels like when a doctor becomes the patient. And that conversation is very different.